A recent news story out of Victoria claims some vets are charging upfront fees of $2,000 or more for emergency treatment for things like snake bites to dogs, and it has some pet owners up in arms. So we wanted to see if this was price gouging by a few or a legitimate claim. Dr. Ingrid Goodman from Sydney's Animal Referral Hospital explains.
It's normal for any procedure, especially at emergency centres, and it protects the vets and the hospital, because sometimes, and unfortunately, you just need a couple of cases to burn you for this to happen, where you'll do everything that you can for an animal and you might not get a very good result. For example, the animal might die despite everything that you try and do, and then you have owners that will refuse to cover the costs or to pay the bill.
How would they refuse to pay the cost of the bill? I mean, if they've brought their animal in, they obviously love it enough to...
Oh, when it settles into their mind, this is how much it really is, and perhaps if they realise they just don't have that sort of liquidity at hand to pay that bill.
Yeah.
It does get a lot of people in strife.
Okay, so what's involved? Why is it so expensive to treat, say, a snake bite?
Right, well, we see snake bite quite commonly here at the Animal Referral Hospital, and it does depend a lot on what type of snake has bitten the animal. If we know for sure that the snake was a brown snake, for example, we can use brown snake antivenom, and that is cheaper than the multivalent antivenom. So when you don't know what snake it was, you're forced to use the multivalent serum, and that is triple the cost almost. So to the client, we're charging them like $900. And that's just for the vial of antivenom. That doesn't even cover the cost of putting them on IV fluids, or the cost of being hospitalised for 24 or 48 hours, or even covering, if we need to check if maybe they need a blood transfusion or plasma transfusion to help them get over that envenomation, or even if they need antibiotics afterwards. That $900 is just for that one vial, and in some cases dogs need multiple vials. So
emotionally, it must be very hard if someone comes in and discovers how much all the treatment's going to cost.
It is, and it is really hard. It's something that emergency vets have to face all the time in emergency practice, because emotions are running high. Fortunately, there are other solutions. We've got a system in place called vet pay. So people just have to pay a percentage of what we think that the total cost is going to be, and if they can cover that up front, so that makes it a fraction of asking for a 50% deposit, for example, which might be $2,000. They might only have to put down $500, and then this vet pay company effectively gives them a loan to cover the rest of that cost. So that's one thing that we have in place here, at least, that I think helps people. If they've got a good credit history, that might be the limiting factor for some people to be able to apply for that.
So Ingrid, what happens if an animal's brought in and needs immediate surgery or other work and you can't find the owner straight away?
I really hate those situations. It's really difficult. We are obliged to at least provide first aid, so that will be what we do in every situation. But if it's a case that is far more critical, and for example it needs to go on a ventilator, or it's going to need some sort of emergency surgery, we're probably not going to go ahead with that if we can't find an owner that A, wants that to happen, and B, can cover the cost for us to do that. And some people might disagree with that. That's just, it's still a business at the end of the day. We still have to try and pay all of our staff that are working here.
Of course, pet lovers can get a glimpse of what an emergency vet centre's like from various TV shows, but obviously there's a little bit more to it than just the vets who often star. Tell us about your vet nurses.
Our vet nurses are wonderful. They're really, really caring people, and they're the glue that holds this place together. Honestly, I wouldn't be able to do a shift without the nurses supporting me. They're really on the ball. They'll tell me if anything is going awry with any patients, and I value every single one of them.
As you can see, the vets and vet nurses at the Animal Referral Hospital in Sydney are a dedicated bunch of people, and as Dr. Ingrid explained, emergency veterinary care can be expensive, and it's not unusual to sometimes be asked for some kind of upfront part payment, but there are several ways to help ease the pain on the hip pocket. Just ask your vet about pet insurance next time you see them, and don't forget to ask them about the vet pay service. Sounds like a great initiative that helps vets and pet owners.